In full protective suits and rubber gloves, a deep clean at this GP surgery in Brighton. Of the 4 new cases of novel coronavirus announced today in the UK, 2 of them are healthcare workers, and at least one of them is thought to have been a member of staff at the County Oak Medical Centre. They have been advised to isolate themselves. Public health officials say they are now working urgently to identify all patients and other healthcare workers who have been in close contact. And this is all about contact tracing. So far, all the recent cases come back to one man. A UK businessman attended a conference in Singapore before going skiing in France and then returning to Brighton. He tested positive for novel coronavirus and is now associated with 10 cases in France, Mallorca and in the UK. The question now is whether this businessman is a super spreader, not an official term, but taken to mean someone who infects more people than normal.
Obviously, some people can transmit the disease. They may transmit it because they're in close proximity to lots of people. It doesn't make them a super spreader. And we have to think the opposite, is that there are many people who have been in contact with people who had the disease and it's not spread to them. So I think it's too early to say that there are people spreading it worldwide at the moment.
Yet today the World Health Organization said the cases in France yesterday and the UK today are concerning because these people had not travelled to China.
The detection of this small number of cases could be the spark that becomes a bigger fire. But for now, it's only a spark. Our objective remains containment.
And today the government announced new restrictions on any individual considered by health professionals to be at risk of spreading the virus. The regulations apply to any individual seeking to leave supported isolation before the current quarantine period of 14 days is complete. The PA news agency reported that one of the 93 people currently in quarantine here in the Wirral attempted to leave, prompting this tightening of the laws. And this afternoon, St Mary's Independent School in Southampton was closed after some students who'd travelled to China developed coronavirus symptoms. They have been put in isolation. Confirmed cases outside China remain low, just 319, but inside the country, more than 40,000 patients have been confirmed, with 909 deaths.
Well, a short time ago, I spoke to Paul Cosford, who's the Emeritus Medical Director of Public Health England, and I began by asking him what plans were being made in case the virus begins spreading further here.
Of course, it's early days still in the course of this infection. We're very clear that at the moment the right thing to do is to identify everybody early and to do all that contact tracing to reduce spread. That's where our focus is at the moment. Of course, we've got a whole range of contingency plans in place if something else happens and if we do get more widespread infection, but that's not the position that we're in at this stage.
Right, but what are the plans for if it gets much bigger?
Well, there's a whole range of plans that we have from the point of view of Public Health England, and the NHS itself will have all its plans to surge capacity as necessary if we do see more cases in this country and if we begin to see people who get unwell as a result of this novel coronavirus.
Well, what is the plan? I mean, because you don't have enough isolation beds, do you? So what will happen? I mean, will you have sort of whole wards or whole hospitals as they have in China?
The NHS has a whole range of plans.
Yeah, but what are they?
Well, there are a number of phases to those plans. The first phase is to treat people within the existing capabilities that they have, and then there's a range of phases they will go through if they need to surge that capacity and to handle more people.
So this is not a serious and imminent threat at the moment in Britain?
So the risk to the UK population is moderate. That's the risk as defined by the UK Chief Medical Officers. It's important to distinguish that from the use of the term serious and imminent threat, which was a legal term that was used in order to pass some regulations today that have been announced to make sure that if people do need to be in what we're calling supported isolation for 14 days, that they can remain in that isolation for the 14-day incubation that we're concerned about. That's not to say that there's a serious and imminent threat to widespread infection in the UK.
The rate of people dying from this is about 2%. That's much higher than sort of normal flu, which does obviously kill many people every year. If this does become a widespread infection in Britain, as people are acknowledging is possible, that's an awful lot of casualties, isn't it?
Well, there's two things to say to that. One is that the actual rate of death is still unclear. You're right that roughly 2% is the current best estimate. I think many people would say that as we understand the infection more, as we see how many people have been infected but not identified in China as being infected, that rate of people who run into the most severe problems and sadly die as a result may well become lower than that. And that's why all our efforts at the moment are to identifying anybody who's come to the UK and has the infection quickly, and doing all the contact tracing that we're doing and making sure that we're handling all of those contacts. Of course, the fact that this week the 4 cases that we've announced today were all from our list of contacts does suggest that our contact tracing at this stage is working really rather well.
Well, that was Professor Cosford talking to me earlier. Joining me now is Dr. Natalie McDermott, who's a clinician and lecturer in outbreak disease control at King's College, London. Well, there's the man in charge saying we've got plans, but being quite coy about what they are. Are you convinced that they are on top of this?
Yeah, I'm convinced that they're on top of this at the moment, yes. There's certainly scale-up plans within the NHS that can be implemented if needed. But at the moment, I think, as he was saying, we've got very robust contact tracing methods. And that's apparent because we've identified these 4 cases here in the UK today. There were a further 5 identified in France over the weekend. And we can link all of them back to the 3rd case in the UK from Thursday last week.
I mean, these are the sparks that the WHO is talking about. And when they talk about, you know, sparks and fires, we can all conjure that image, and it's quite frightening.
It is quite frightening, but I think that actually I would interpret the sparks that the WHO is concerned about more as being people that are infected and we don't know how they became infected. Right now we have sources of infection and we can follow up their contacts and make sure they are tested and isolated appropriately. In Singapore at the moment we have a few handful of cases where we have no idea who their contact was. That is more concerning.
I mean, here, obviously, because it's so few cases, it's things like people in Brighton who are worried about coming into contact with people who might have gone to this doctor's surgery, which may be affected. I mean, what should people be doing? Should they be sending their children to school, wearing masks, all those sorts of things is what people at home are wondering.
Yeah, so I'm sure that the doctor who's related to the surgery, he knew he had had contact with this individual. So at the point at which this individual tested positive last Thursday, he probably then took measures to self-isolate at that point, because that would have been the advice from Public Health England at that time. Therefore, he probably hasn't had any contact with patients or his colleagues since that point. So the measures that are being taken now are really just to make sure, absolutely, that the surgery is now clean, that anybody who might have had contact with him is isolated, and they want to trace any patients who may have seen him face-to-face.
So people there in Brighton don't need to be taking any further precautions that anyone else in the country is taking, is what you're saying?
No, at the moment they don't need to take any further precautions. The best thing that they can do is regularly wash their hands if they have travelled on public transport or been shaking people's hands.
And what about travel? Because the government is warning about people coming back from places like Singapore and Hong Kong. But, I mean, all these travelling hubs just link up with each other. People might fly from Singapore to Dubai or Istanbul or whatever it might be. Should people be wearing masks when they're getting on aeroplanes, for example? It's half-term next week. A lot of people are going on holiday.
So masks are of limited utility unless you're using the right type of mask in the right way and washing your hands frequently whenever you touch it. So actually, at the moment, Public Health England's advice is not to wear masks because we don't really know how effective they are, particularly not the basic surgical mask that you're seeing is relatively ineffective in terms of protecting people. Now, if someone's unwell, to wear a mask might be beneficial because it will limit when they cough and sneeze how far the spray goes, and it will also stop them covering their mouth with their hands and then shaking hands with someone. But wearing a mask isn't necessary. It is important if people are travelling, though, to follow Public Health England's advice that if they return from an affected country, they may need to self-isolate for 14 days.
Dr. McDermott, thank you very much indeed.